good day, sir. I am John Clyde Pipito. In this video, I'll be demonstrating the routines and the projections of the hand, wrist, and thumb.
So for the projection of the hand, the clinical indications, it is used for fractures, dislocation, or foreign bodies of the phalanges, the metacarpals, and all joints of the hand. So our technical factors, the minimum SID is 40 inches and the IR size is 24 by 30 centimeter non-grid. So I'll start first with the PA projection of the hand. So for patient position, the patient is seated at the end of the table with the elbow flexed and about 90 degrees and the hand and forearm is resting on the table. So for a part of the position, the hand is pronated with the palmar surface in contact with the IR and the fingers are slightly spread. So align the long axis of the hand and forearm with long axis of the IR. Then the CR is directed to the third metacarpophalangeal joint. So the next projection is the PA oblique projection of the hand. So our part of the position, the hand is pronated on the IR, center and align the long axis of the hand with long axis of the IR. Then rotate the entire hand and wrist laterally 45 degrees and all digits are separated and parallel to the IR. Then for CR, the IR is directed to the third metacarpophalangeal joint. The next projection is the fan lateral lateromedial projection of the hand. So the part position is align the long axis of the hand with long axis of the IR and rotate the hand and wrist into the lateral position with thumb inside up. Then the fingers is spread and the thumb into a fan position. Ensures that all digits including the thumb are separated and parallel to the IR. Then the IR is directed to the second metacarpophalangeal joint. So the next projection is the lateral in extension and flexion, the lateromedial projection of the hand. So the part of position is the hand rotate and the wrist with the thumb side up into the true lateral position. So the second to the fifth metacarpophalangeal joint is centered to the IR and CR. So the lateral and extension, they extend the fingers and thumb in support against a radiolucent support and block. Ensures that all fingers and metacarpals are superimposed directly for the true lateral position. So the CR, the IR is directed to the second to fifth metacarpophalangeal joint. The next projection is the AP oblique bilateral projection of the hand. The part position is the hands supinated and place medial aspect of both hands together at center of the IR. So internally rotate the hands 45 degrees and support posterior aspect of the hand 45 degrees radiolucent blocks. Extend the fingers and ensure that they are relaxed and slightly separated but parallel to the IR. Abduct both thumbs to avoid superimposition. So for CR, so the IR is directed to the midpoint between both hands at the level of fifth metacarpophalangeal joint. So the next projection is the wrist projection. The clinical indications, it is used for fractures of distal radius or ulna, isolated fractures or radial or ulnar styloid processes, and fractures of individual carpal bones. The technical factors, the minimum SID is 40 inches. The IR size is 18 by 24 centimeter, non-grid. So the PA or AP projection of the wrist, the patient position, the patient is seated at the end of the table with elbow is flexed about 90 degrees and hand and wrist is resting on the IR. The palm down, drop shoulder so that the shoulder and elbow and wrist are on the same horizontal plane. So our part of the position, align and center the long axis of the hand and wrist to the IR. Then, with the hand is pronated, arch hand slightly to replace the wrist and carpal area and close to the contact with the IR. So the IR is directed to the mid-carpal area. The next projection is the PA oblique projection and the lateral rotation of the wrist. So the part position, align the center hand and the wrist to the IR. Then pronate the position and rotate the wrist and hand laterally 45 degrees. Then the stability place a 45 degrees support under the thumb side and support the hand and wrist in 45 oblique position. So the CR is perpendicular to the IR and directed to the mid-carpal area. The next projection is the lateral lateromedial projection of the wrist. So the part position, align and center the hand and wrist to the true long axis of the IR. So adjust the hand and wrist into a true lateral position with fingers is comfortably flexed. Its support is needed to prevent motion. Use a radiolucent support block and sandbag and place and block against extended and hand and fingers as shown. So the IR is directed to the mid-carpal area. So the PA and PA axial scaphoid with ulnar deviation of the wrist. So the part position, the wrist as for the PA projection, the palm is down and the hand and wrist align with the center of the long axis of the IR. So without moving the forearm, gently invert the hand and move toward the ulnar side as far as the patient can tolerate without lifting. Then the angle of the CR is 10 to 15 degrees proximally. So the next projection is the PA projection of radial deviation of the wrist. So the part position, the wrist as for PA projection, the palm down with wrist and hand aligned with the central axis. So without moving the forearm, gently invert the hand and as far as patient can tolerate without lifting or rotating the distal forearm. For the CR, the IR is directed to the mid-carpal area. The next projection is the carpal canal tunnel or the tangential infero-superior projection of the wrist. So the part position, ask the patient to hyperextend the wrist as far as possible by the use of a piece of a tape or hand and gently but firmly hyperextending the wrist until the long axis of the metacarpals and the fingers are as near vertically 90 degrees to the forearm, and rotate the entire hand and wrist about 10 degrees internally toward the radial side to prevent superimposition or pisiform and hamate. The CR angle is 25 to 30 degrees to the long axis of the hand. So direct CR to a point 2 to 3 cm distal to the base of the third metacarpal. So the last projection of the wrist is the carpal bridge tangential projection of the wrist. So the part position, so the dorsal aspect of carpals is centered to the IR and gently flex the wrist as far as the patient can tolerate or until the hand and forearm form as near 90 degrees night angle as possible. So the CR, the angle of the CR is 45 degrees to the long axis of the forearm. Then direct to the CR to a midpoint of the distal forearm about 4 cm. The next projection is the AP projection of the thumb. The clinical factors is fractures and dislocation of the distal and proximal phalanges and distal metacarpal. The technical factors are the minimum SID is 40 inches. The IR size is 18 by 24 centimeter, non-grade. So the part of the position is first demonstrate this awkward position on yourself. Then internally rotate the hand with fingers extended until the posterior surface of the thumb is contact with the IR. Then align the thumb with long axis of the IR. Then center the first metacarpophalangeal joint to the CR and to the IR. So the CR is perpendicular to the IR to the first metacarpophalangeal. Projection of the thumb is the PA oblique projection, the medial rotation of the thumb. So the part position, abduct the thumb slightly with palmar surface of the hand in contact with the IR. So places the thumb in 45 degrees oblique position. Then center the first metacarpal phalangeal joint to the CR to the center of the IR. Then the IR is directed to the first metacarpophalangeal joint. The lateral position of the thumb. So the part position starts with the hand is pronated and thumb abducted with fingers and hand slightly arched. Then rotate the hand slightly medial until the thumb is in true lateral position. Centers the first metacarpophalangeal joint to the CR and center to the IR. And the entire lateral aspect of the thumb should be direct to the contact with the IR. So the IR is directed to the first metacarpophalangeal joint. So the last projection is the PA stress thumb projection. So the part position. So both hands side by side to center of the IR, rotated laterally into 45 degrees oblique position. So in true PA projection of the both hands, place and support as needed under the both wrist and proximal thumb regions to prevent motion. So the CR is perpendicular to the IR and directed to the midway between metacarpophalangeal joint.